South Wales recorded 38 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 26 were locally acquired and are linked to known case or clusters, and of these, 13 are close contacts and 13 household contacts of previously confirmed cases. Again, indicating and demonstrating what the Premier has said. When we find a case in a family, we find that everyone in that household has the disease. Clearly, the household sizes, you go in and find one case and there might be 5 other people in the household, they're infected. It is critical that we get to those households as early as possible. So again, make sure that even now we're asking if anyone you have symptoms, even considering get all your household tested at the same time to actually reduce that time where we're actually getting those sequential notifications. Of today's 38 cases, 17 were in isolation throughout their infectious period and 9 were for isolation for part of their infectious period, and 11 cases were infectious in the community, and 1 is under investigation. What we are now seeing is cases pop up in other overnight, some cases that are popping up in other geographical areas. So I think it's really important that every time we leave our home, we need to consider that we may come into contact with someone who has COVID. It is therefore so critical that we minimise our movements. In terms of our caring responsibilities, that should be one person that has to care, and it's not a discretionary visit. It's not because the person wants to see you. It's because you absolutely need to be there to either deliver food, to check something, to fix something, to feed them. We're not talking about discretionary visits. Also, it's critical that we do not have this as, okay, I usually have my extended family, I see them as my family. And what we're asking people to do is redefine the sense of family. The family unit is the household, people you live directly with. Also, it's important to note that we've had 40 COVID patients admitted to hospital. There are 11 people in ICU, 3 of whom are ventilated. 17 people admitted to hospital at the moment with COVID are under the age of 55, and of those 10 are under the age of 35. Of the 11 people in ICU, 1 is in their 30s, 1 is in their 50s, 5 are in their 60s and 4 are in their 70s. I think it's incredibly important to again emphasise, yes, the orders permit certain activities, but what we're asking the community to do is please apply common sense. If you are leaving your home, ask yourself, do you really need to leave your home? If you're going shopping, think about what you absolutely need. Do the list, get in and out. This is not the time for browsing. This is not the time for what I might need. We're asking the community to only shop for those essential goods. Now, the reason we haven't defined essential is because clearly people may need blankets, rugs, school shoes. These are the sorts of things that are defined essential, and I have got confidence that the New South Wales community actually understands what we mean by essential. So no browsing, no I might need this in a few weeks' time, and whenever you can, shop online. I understand the supermarkets have got also very rapid processes for click and collect, but they've also got good processes in place, so some real tips about making a list before you go, get in and out. Also, when you are moving about, wear your mask correctly over your nose and mouth and put it on well ahead of when you're entering the premises to make sure that you're keeping yourself safe and others. In terms of the areas that we're concerned about, we obviously need everyone to be concerned. So when I read out these suburbs, it doesn't mean that if you're in a different suburb, you don't have to be worried. But what we're trying to highlight is areas where we're particularly calling out for testing. And we've done this traditionally in terms of saying areas of concern. So the Fairfield local government area, places like Bosley Park, Smithfield, Fairfield, Glenfield, West Hoxton Park, Bass Hill, Greenacre, St John's Park, Bonnyrigg, Bankstown, Roselands, they're examples of areas where we know that we're seeing cases, but the cases will change. And that is why it's critical that everyone sees themselves at risk. Again, I can't emphasise enough that the employers and businesses often have very understanding if anyone has symptoms and cannot come to work. I just would again urge everyone to not attend work if you've got symptoms. In this context, I'm sure that all employers and businesses will be very understanding of your need to stay home and get a test. That is the best way you can protect the community. In terms of young people, I understand that young people, my messaging around young people is that you have a great role to play. We know that you often support others with caring functions, and again, to listen to those messages to make sure that they are essential caring functions. We also want young people to reach out through their social networks. They can do that quicker than our contact tracers can. Make sure that they're really encouraging high rates of testing along their social groups. And they can play a part in reinforcing these messages. And we know that young people care dearly about their loved ones and wouldn't want to put them at risk. So if Granny says that they want to have a visit, please do it on the phone or FaceTime. And please explain to others why it's so important that we don't have that connectivity across households at this time. So use digital and phone options. As I said, in summary, one person should be making the care and compassionate visits, and if it's possible, keep it to the one person. All of these little steps reduce the risk of contact, and COVID is spread through human contact, through proximity, particularly in indoor environments. So if we can keep people out of those settings, we can stop the spread.